classroom. So we do, for everybody that we have internships with, we do a lot of work around documentation. We actually have all of our interns do some documentation. It's co-signed by a counselor, and we read it and go through it with you about, you know, what you may want to add, what you could take out, those kinds of things, because it is important, and the more proficient and efficient you are at it, the happier you'll be, and the happier your boss in the future will be. So it is a learned skill, and we know when students come in that they don't know. Not all agencies do it exactly the same, you know, so you have all those nuances as well. But it is an important component. It's kind of like getting insurance authorizations to do your work. It's a necessary part of the job. Yes?
And so that's part of, like with our program, your professors and myself will integrate documentation into various classes. There's not one course that is just focused on documentation, but part of the issue is that it varies from agency to agency, like you just mentioned. Mm-hmm. So, but it is important to get the general principles to documentation and like the purpose. So not only is it for billing and insurances, like Carrie had mentioned, but also for your own reflection of what's happening in the session. So thinking about what you guys do, reflecting after your counseling sessions, that would be like documentation in a way, not as formal, but that's just a way for you to reflect. But then also, if anything were to happen, you have documentation that you address this issue. Or, I mean, there's so many different, insurance and billing, but also you even think about, the first thing that comes to my mind was the Colorado shooting, when the woman, the psychologist, the school counselor had an actual document that said she did not address that this guy had all these issues, but she had the documentation of him reporting it. So things like that, down the road, if anything, suicidal ideation, there's so many different things that it can be utilized in the legal system too.
Exactly.
So,
and the other piece of that is, if you see 25 patients that you're helping in some way, remembering from last week to this week, or from last week to 2 weeks from now, what did we do? How far did we get? For me, I use my documentation for that. I still, even as I have my director role, I still carry a small caseload, in all honesty, because I want to, but I think that it also helps me be better at my job, because I'm doing what everybody else is doing, and I have the same parameters. But I use it to go back, so before I see, for example, late this afternoon, I will see a patient. Before I see her, I will go back to my note from the last time and see what we talked about. Did I ask her to do anything between last session and this session? Because in many ways, you give somebody homework, you tell them go home and practice this, or do this exercise, or whatever it may be. Well, if you give that assignment to somebody, it's kind of important that if you did it, you remember to ask how it went. But if you don't write it down and go back and look, you're actually likely not to remember, because when you're seeing numbers of people and some of the things that you have people do are close to the same, but not exactly the same. So I use it for that. The other thing I always remember is if I was in a car accident this afternoon and I couldn't go back to work for a month or 2 months, and somebody has to see my patient for me while I'm gone, I want them to be able to read my note and know what we were doing and know the progress we were making, the challenges we were having. So it covers a lot of territory, and yet you don't want it to be 4 or 5 pages long. So it's finding that balance. So you use the documentation personally with your coworkers, those kinds of things. When you're interning, it helps us know how you're doing. It helps you know how you're doing. Those kinds of things. Very often when we have a student who has had a session or worked with someone, it's when they start to do their documentation that they realize, I really wonder about how I did this. And it is good then for that supervision piece where you talk about the patients you're seeing and what you're doing, where you're finding great success and where you may be finding some opportunities that you're being challenged with that particular patient. So it's very helpful from all of those areas and is absolutely vital. You mentioned suicidal ideation. In all the years I've practiced, because I practice with working with trauma survivors, I don't remember having a client that didn't have suicidal ideation, wasn't actively suicidal. I've had clients who self-injure and those kinds of things. Those notes were vital to me should something have happened. I've been very blessed. In 22 years, I've lost one patient to suicide. And given my caseload, that's fairly surprising and that's very difficult. But again, if that patient shows up in the ER, because I'm part of a hospital system, they can see my note. If I send someone to the hospital because I'm concerned, they can see my note. And if I send somebody to the hospital, as they're going to the hospital, I'm putting the note in so that when they get to the emergency room, the doctors and nurses in the emergency room have that as part of their triage. So all of those things. But when I lost my patient, we always do sort of a look back. What happened, did we miss anything, those kinds of things. And it was that documentation that I was aware, that I was addressing it, that, we had been talking about how safe she was or wasn't, and she actually was doing what appeared to me to be relatively well when she took her own life. So you want to think about all those things. I tell people, if you don't document those important things, then it didn't happen. If you have a legal issue, if it's not in your documentation, it didn't happen. And I'm certainly not trying to scare people away because, it doesn't happen very often. But you want to be able to show that you had talked about it. Now sometimes you're going to have folks who don't tell you anything and you can't put it in the note because you don't know. But when you know, those notes are important for all of those reasons. And again, you're trying to use that also to help you guide your work with patients. It's getting into a field that truly people live and die. People have physical injuries and they can't do the work that they used to do. And they become very depressed, very sad. Those kinds of things, yes.
But I agree with you what you mentioned earlier. A lot of times the documentation is like the worst part of the job. But I found when I was practicing that if I could reframe why I'm documenting, instead of it being about insurance or billing, if I thought about, well, it's really to benefit my client, then I enjoyed it.
Yeah.
Because, again, it's just that mental flip where you're doing it not because you want to get the money or the billing, insurance, and all that, which is typically what counselors think about when you hear the word documentation is like, yeah, for billing or, you know, but really, if you, like you had mentioned, if you go back and say, okay, it's really just to benefit my client, then you want to do it. Then it's this collaboration, you know, and we've talked before, sometimes just the documentation of having like that written contract with you and the collaboration with your client where you both sign a form that they're gonna engage in this exercise or whatever it might be. But I think just having more of a optimistic outlook on that one component, because you have to do it, and it's dreadful sometimes, like, oh, that's like a lot of paperwork, but you learn to master it, and you learn what is to help the client, and it's not as bad as it sounds. But
And when
yeah.
you do it, thinking about it as a way to live up to your end of the agreement with your client,
Yeah.
then it also helps you know what you want to put in your note. And then that goes much more quickly. So if you frame it as, this is about what happened today and what he or she agreed to do, what I agreed to do, and what happened, and you look at it that way, then it helps you figure out what you want to put in it. Because it's really, for me when I do it, it's what do I need to put in today so that the next time I see him or her, I will know where we left off, where we begin again. And again, if you've asked somebody to do something in the 2 weeks, you really want to go back and check whether they were engaged, if they had problems. But again, it's my responsibility at that point to remember and to check in on it. It would be very disrespectful for me to think that it was important enough for me to ask somebody to do, because I'm taking them outside their comfort zone usually, so I'm asking them to do something and then not ask how it went. You know, that's not okay. That my part of the bargain then is to work with them on what went well and what was challenging. So if you use it from that, if you document from that point of view, you're going to put in your notes what needs to be in. It's going to be obvious to you. It's going to make sense to you. And if somebody has to pick up that patient for you, it's going to make sense to them. So, and then, you know, the added benefit is that your agency gets paid. But, you know, you need to be aware of that. I don't do it. I know I need to do it in case something happened and there was some legal issue. But again, I don't do it like, okay, I've got to say this because what if this happened? I really do it because it's how I can frame my therapy, and it'll help you. You know, sometimes patients think they're not making any progress. You know, I'm not any better now than when I came in. And if you have your notes, you can say, okay, but here, let me pull these up. And I've done this. I pulled them up on my computer and said, when you came in, you were having this, this, and this going on. And then we got to here, and then and you can show them some progression even when they're stumbling and, you know, feel like they're starting all over again. So there's so many ways that your notes become part of the therapy. At the end of the day, they're still not my favorite thing to do because I would still rather be talking to the people. But they're a very important thing, and when you frame it that way, it helps you know what to put in a note too. So that's something to remember. And as you take your classes, you know, ask all the questions you can ask. When you go out and do your internships, ask all the questions you can ask about documentation. And, you know, mastering that will make your life much more pleasant, and it will be very useful for you. Very useful for you. So, questions about that? Because it's sometimes something that not all students get, and then they arrive and they're just amazed that there's all this paper stuff. So,
so is it electronic?
Yes,
charting?
it is for us. It is for most places now. There are some small chemical dependency treatment centers, some small rehabs that don't have electronic medical records. It's fairly expensive to start up, but ours is all electronic.
So then is the only place to access them like from a work computer?
Mm-hmm.
So all the documentation and all the reading and all of that would have to be done on site?
On site.
Okay.
Mhm. So your documentation, if you're with us, needs to be done on site for confidentiality and safety reasons. Those computers don't leave the site. So it's a balance in your day or in your work week, depending on how you do it. There are people who chart once a week. If I charted once a week, my Monday would just be a blur by Friday. So I really am pretty disciplined, and I do it either at the end of each day or very first thing the next morning. One of the things that I do, I'm at work by 7 in the morning, and most of the staff doesn't start getting there until 8:15. Therefore, I have quiet time, and I can get my charting done if I didn't get it done at the end of the day before, but my preference is to do it in the same day. There's, for therapy sessions, they're 45-minute sessions, so if you're thinking about being an LPCC at some point, they're 45-minute sessions. The whole point of it was that you could document between patients. Sometimes that works and sometimes it doesn't. First of all, your patient may not quite get out the door at 45 minutes. I mean, if they're telling you something, you can't just go, oh, wait, we're done now. And you may be interrupted by a colleague. I mean, there's a lot of reasons why it doesn't happen right then. But when you can do that, that's really optimal, because you can remember what you just did for the last 45 minutes usually. So, that's really optimal. But finding a way to manage what works for you and manage your time is going to be important. Nobody's going to, watch you do it. You're going to have to figure out how to manage your own time and make time to do your documentation as well. The sooner after you've met with someone, the better that's going to be for them and for you, because it's going to be freshest in your mind.
I also think, I like what you mentioned earlier about staying present with the client, because so by documenting, you're forced to stay present with that person, because you know that you have to write about it. We don't, subconsciously, we don't think about that. But just if if we were in this class and I said to you that you're going to have to write a paper on this chapter, hands down, you're all going to pay attention because you have to write a paper on it, right? Where this documentation and knowing that you have this system of time management for yourself, you would say to yourself, okay, I need to stay focused and really pay attention to what's happening right now, because I got to remember to write that down. So just think about it. That's just another way for you to implement mindfulness and staying present moment.
And being mindful and present is the most important thing. Pay attention to what they're telling you, what they need. Sometimes if you pay attention to your patient, you'll figure out what they need, and they're talking to you because they don't know what they need. They know something's wrong. For years now, I've told all of my patients that when I see them, I'm collaborating with them. They have their own answer to what they need to do with their life. They just can't figure out how to get it out. They can't access it. I'm not there to do anything magical except to help them find their own answer. And so if you're present with them, and if you frame it that way, at least for me it's worked, because it also says, I'm working, but you're working here too. We got to do this together. You don't want to be working a whole lot harder than your patient is.